I think Dr. Deepthi did an excellent presentation, and also she brought the comparative study of IV iron and shows that this particular brand stands tall. Secondly, I think my request, a sincere request, is to all of you that please see to it that one of those colleagues of yours who are not been using it, please motivate them, please teach them, and that is what is required. 100% people who are postgraduate gynecologists should be using it, and I see no reason why an MBBS doctor should not be able to use it. So this is, I think, is the basic exercise, and all of us are worried about this particular thing, that IV iron need to be used. I think all of you are very clear as far as the reaction is concerned. I think one has to keep an adrenaline ampule and the syringe, and you should have hydrocortisone, but uska zyada role itna nahi hai. The role is more of an adrenaline. You have to be prompt, and I think my dictum is that the medication is given over a period of 15 minutes. People should be around, and not only that, you should take an initially vitals, but during the procedure also please see to it that the oxygen saturation and pulse and everything is asked, and you must ask her time and again, are you feeling comfortable? So I think 15 minutes to aise hi nikal jate hain, and one should be able to do this. Now coming to my favorite topic, breaking the cycle of intergenerational anemia in pregnancy. I'm also very fond of talking about anemia mukt pregnancy in India, and I feel that instead of aiming 11 gram percent at the time of delivery, one should aim at 12 gram percent, and अपने दिमाग में लगाना है कि चाहे pregnancy हो चाहे no pregnancy हो, you should aim at 12 gram percent at the time of delivery. And the crux of, be obsessed that all your moderate anemia, that is 10 gram and less, you will be treating her with IV iron. आप जैसा कन्विंस करेंगे वैसे ही होगा. तो जैसे मैडम ने बताया कि ओरल आयरन जो है आप बीडी भी दे दोगे तो IV आयरन का मच बेटर रिजल्ट्स है, एंड पेशेंट अंडरस्टैंड. बस उसको एक चीज़ ये बात बताने की योर IQ ऑफ द चाइल्ड विल डिपेंड अपॉन योर हीमोग्लोबिन एट द टाइम ऑफ डिलीवरी. तो आप डिसाइड कर लो कि आप इंटेलिजेंट बेबी चाहते हो कि आप अपने बच्चे को चपरासी बनाना चाहते हो, तो यू विल फाइंड शी विल लिसन टू यू एवरीथिंग वट एवर यू वांट टू से. And here again I will say, please follow the Government of India guidelines in toto. They are very clear what dose to be used. They are very clear how it has to be used. Mild anemia, it is 1 tablet. Moderate anemia is 2 tablets, but preferably will be that you use IV iron. I also talk on adolescent anemia because I think whenever you find an adolescent is anemic, it's a national emergency, and the mission of the Government of India is that by 2047 the anemia incidence across the country as far as girls and a woman are concerned, it should be less than 5%, and hemoglobin of the aim is the hemoglobin of these girls and women should be 12 gram percent or more. I differ when Dr. Deepthi told you the picture of anemia across the country. In the globe, 2/3 of the globe is developed world. पूरा ग्लोब को पूरी पिक्चर चारों तरफ से देखो, पूरे ग्लोब में क्या क्या है. 2/3 is a developed world, and developed world has anemia not more than 10%. Majority is 5% or 3%. So ये जो हम लोग को भूखमरे वाले देश है उनको में उसमें ये ज़्यादा प्रॉब्लम है. So this is what it is. Now you can see these adolescent girls are smiling, 11, 12 years people, but they are complaining to each one of you. They are trying to look at your eyes and saying that we are this victim of the social and political neglect, and that is why the incidence of anemia is not going with us. Now what is this intergenerational anemia? Anemic mothers make anemic babies, and they're born with a little less IQ, and they grow up into anemic adolescent girls, and thus perpetuating the cycle of poor health and anemia from mother to child across generations. This menace of intergenerational anemia is it has been there for centuries in Bharat, and the cycle is never ending. It's going on and on. I will tell you how I have looked at anemia across the country. I joined medical college in 1964, and in physiology department we got hemoglobin. We started doing it and we got it tested. At that particular time, the incidence of anemia was 90%. So we were sent the same day in the week following that in nurses' hostel also. And we did, the study was the same, 90%. We find this is in 2000, in fact, to be exact, 98, 99, we did a lot of work in slums in Delhi, and we screened almost 25,000 people as far as anemia is concerned. In slums I am talking about. And we found the incidence of anemia, whether they are children, whether they are boys and girls, if they are adolescent or if they are women, the incidence was 90%. And that was I presented in Indian Medical Association, and they took it as a nationwide movement. And Pan Bharat, Kerala said at that particular time, no, we do not have anemia. So we said, look, get it done for public school, for boys exclusively, and get your hemoglobin tested. And again, the incidence was same 90%. And from there onwards, the government also took it very seriously, and Anemia Mukt Bharat movement got started because the government became very serious. And thereafter, you could find that the government agreed for midday meals and also giving iron folic acid tablet. This was given on a weekly basis. One could see there was a drop in hemoglobin, was very rapid up to 2015, and from 90% it had come down to almost 50%. But when the when the National Family Health Survey 19 came, and then we found, in every category the anemia incidence increased by 5 to 7%. And that was an eye opener and jolt to the movement of Anemia Mukt Bharat. And it is survey 5 which was told that it has increased instead of decreasing. So 60% of adolescent girls were anemic in 2020, but the boys, who are 90%, were 30%. So as for the severity of anemia is concerned, 40% suffer from moderate to severe anemia. You can see in this particular picture, it is, to be exact, it is 39.5%, but just make it 40%. People have moderate to severe anemia. Thank God the severe anemia has come down to just 3%, and the rural and urban gap is rural girls show incidence of, the gap is by 12 to 15% more in the rural areas. Higher anemia rate is seen in the rural population as compared to the urban population. There is a north and the south divide also. You find that people are anemia free as far as south is concerned, and as far as the north is concerned, it is almost the half. So instead of general 50%, it is less than 40%. मतलब नॉर्थ में एनीमिया ज़्यादा है, साउथ में एनीमिया कम है. Dr. Deepthi, I just wish to tell you that the dark blue is a developed world where the incidence of anemia is less than 5%. You can see here the developed nations have incidence of 3 to 5%, Canada has 3%, US has 5%, majority of the women and girls have a hemoglobin around 10% in the developed world. And India has an incidence of 60%, women and girls are anemic according to the latest survey of National Family Health Survey 5. Now the question comes, how long this particular thing is going off intergenerational anemia. It is for centuries because it has been documented in colonial records, and WHO also has been reporting it since 1950. National Family Health Survey data has been reporting it from 1992, and significant persistent public health concern in Bharat for over a century for women and children that they are anemic. And that's why, somebody said कि हम तो 7 ग्राम में भी डिलीवर करा लेंगे और आपको कुछ नहीं होगा. So that's the kind of words are spoken, for people who are, though they are doctors, but I will call them, they are illiterate. Now do question if why the Western world incidence is 3.5%, 3 to 5%, and why can't, if they can have such a low incidence of anemia, why can't India have the same? And again, same from Bharat ke boys ka, you can see the drop from 2000, it was 90%, they have come down to 30%, that the Y girls are still anemic. So these are two questions we must answer. Why is the prevalence is so high in northern states? They have been called Bimaru states. Nutritional aspect is more. Daily diet is low in iron, and not only low in iron, they are low in folic acid and B12. And it is because we are cereal focused diet we have. There is a high phytate content which is big hampering as far as the iron absorption is concerned. One thing I just wish to emphasize is that weekly iron folic acid with midday meals is for those people who have a hemoglobin of 12 and 12 plus. It is not enough for people who are mild anemia or moderate anemia, leave aside a severe anemia. So the treatment is not possible with weekly iron folic acid if the person is anemic, and this lack of awareness in the school health doctors and the nurses is the biggest problem, and I think we have to see to it that this is addressed. Now, why we should focus on adolescent girls? They make 10% of our total population, and which is about 120 million adolescent girls, and over 60% are anemic today. And if I am talking about northern India, this 60% goes to 70 to 80%. This group is very important because at this age we must realize that they are going to be future mothers, and if they are not educated and skilled, they will not be able to contribute to the national building. And anemia A to Z should be taught and grilled in the schools. They must know their numbers, what unka hemoglobin kya hai. They must also know what should be the hemoglobin of boys and girls. They also must know the hemoglobin of adult women and adult men, and they also must know how to rectify it. Public health consequences are, this particular slide is the most wonderful slide, and you see here, it is the severe anemia which kills the mother. It is the severe anemia which kills the baby. It's the mild and moderate anemia which affects people three ways. Our school performance goes very badly. This brain requires 20% of the total oxygen what the body requires, and it is responsible, your normal hemoglobin is responsible for your focus attention, for a memory recall, and all these things are important for your academic performance. So आपकी अगर बच्चा ठीक से पढ़ाई नहीं कर रहा है तो उसका सबसे पहले हीमोग्लोबिन टेस्ट कराओ और पता करो कि भाई उसके ब्रेन में ऑक्सीजन जा रही है कि नहीं जा रही है. Secondly, the child development, the physical development also gets hampered as a result of anemia. And lastly, the work performance also gets badly affected. आपका हीमोग्लोबिन आज आप देखिए, अगर आपका हीमोग्लोबिन 10 ग्राम % है, you aim to become 12 ग्राम %, and you see your energy levels gets doubled. You become twice, दो शारदा का काम आप कर सकेंगे once your hemoglobin is 12 ग्राम %. So I think this particular slide should be remembered and should be taken seriously, and you must also explain. Now, anemia is a silent killer. You can't always see it. Every 1% reduction in the incidence of anemia in the population saves lakhs of healthy work days. तो आपका anemia का work performance से बहुत कुछ relation है. Now again, this particular slide is $1 million slide. By the time you get your hemoglobin 12, less than 12, your all stores are exhausted. This particular slide I can take half an hour to explain to you. But fact you should remember is that आपका hemoglobin 12 से नीचे आया तो आपके स्टोर सब खत्म हो गए. Is fatigue in girls always psychological? No. It is undiagnosed anemia which is mistaken for laziness and weakness. Anemia causes fatigue and weakness and a poor health, and the government of India videos are far many. आप एक बार देख लोगे और फिर दूसरों को दिखा दोगे कि क्यों आपकी हर चीज़ स्लो है. क्यों आप एक सीढ़ी है उसमें थक जाते हो. तो those videos are such wonderful videos, and I think once you should have an access of it. Malti is going to help you out, otherwise you can get it in the internet very easily. How anemia affects the girl education. Even mild anemia creates a havoc for this girl. Low concentration, reduced memory recall, poor school attendance due to fatigue and the laziness. मम्मी आज मेरा जाने को मन नहीं, मैं थकी हुई हूँ. And this reduces the academic performance. और ये पढ़ाई में अच्छा नहीं करेगी तो her career opportunities also get dimmed out, and she will not be able to contribute what she wants to contribute in the national building. Anemia affects workforce productivity. WHO estimates 1 to 2% of the GDP loss is due to anemia in India. And if we take the cognitive loss, कि वो स्कूल में नहीं गई, वो कॉलेज में नहीं गई, तो उसकी जो बुद्धि है उतनी कम हो जाएगी. तो उस लॉस को लेंगे, then the GDP loss is to the tune of 4%. Girls' employment in the workforce is much less as compared to China and the many countries in Southeast Asia. Is a big social factor, and all of us have to see to it that we take care of it. How anemia spoils maternal mortality. Anemia contributes to 20% of the maternal deaths. Anemia increases the risk of hemorrhage, sepsis, hypertensive disorders of pregnancies, and heart failure. If they combine with anemia, death is sure shot. Severe anemia roughly doubles the odds of maternal deaths. What about stillbirths? Severe anemia triples the risk of stillbirth and the neonatal death. I repeat again, it is the severe anemia which kills the mother and the baby. What is the impact of a newborn and infants? They are low birth weight, prematurity, poor immunity, poor brain development. But remember one thing, hemoglobin of the mother decides the IQ of the child. Hemoglobin of the mother decides the IQ of the child. Infants face problem and of early anemia, poor development, and a poor survival. Kerala statistics shows that infant mortality rate in Kerala is just 5, while the national average is not less than 30. North it is 40 plus. As for the causes and the myths are concerned, we all know that the iron deficiency is the main cause. Poor diet, worm infestation, blood loss are the main causes. Is anemia just due to iron deficiency? No. 90% is iron deficiency nutritional, but other deficiency in nutritional can be folate and B12. And remember Dr. Manjupuri, when she says look at the knuckles and if they're dark, think about that she has a B12 deficiency. Now once Manjupuri had sensitized each one of us, it's a policy with us that we give injection B12 at 12 weeks, and then I again give it around 20 weeks. And she says one shot can take care of the 4 months need for B12 deficiency. Other causes are worm infestation, malaria, chronic diseases, thalassemia, and poor absorption. And that's why the government says that all overall causes must be looked into it when your patient is not responding. Why do women and girls suffer more? They do have menstruation. Repeated pregnancy is no excuse now in Bharat because total fertility rate in Delhi is 1.2. So repeated pregnancy are not the problem. It's the gender discrimination in food distribution which is the problem. I call it the dadi or nani factor, which gives a nutritious food to the girls very sparingly. And ours is a patriarchal society. Food allocation preferences towards male children is definitely more there, and that is only explains why in 2000 the incidence of anemia in males were 90% and why it is 30% now. Does vegetarianism contribute? True incidence of vegetarian people in our country is difficult to tell, but whatever the estimate I could get is 38 to 42% people are totally vegetarian. Rajasthan it was 75%. Vegetarian diets can be healthy, but 3 चोर हैं vegetarian diet वालों लोगों के साथ. एक तो है heavy reliance on the cereals, that is rich in phytates and reduces the absorption of iron. Secondly, lack of vitamin C with meals worsens it. आपको एक बार बताना पड़ेगा कि डीबू एक आपने लेना है तो आपने दाल में भी डालना है और तो अपने प्याज और सैलड में भी डालना है, तो उससे आपका जो आयरन एब्जॉर्प्शन आपकी डाइट में होगा वो फ़ायदा होगा. And bad habit of taking tea and coffee after meals is another menace. This menace is more in the high class society and the upper middle class society like you people. So I will say खाने के बाद इसको नहीं लेना है. क्लियर? कितने लोग लेते हैं? बंद करना पड़ेगा. Give a gap of almost an hour or so. नहीं, कुछ नहीं लेना जी, कुछ नहीं लेना. मैडम पानी भी नहीं लेना खाना खाने के बाद. खत्म हो गई बात. Is meat consumption is the only solution? I'm asking you people. No. Telangana has a state where 98% people are non-vegetarian, but still the anemia rate is the same. So even vegetarian sources have plenty of green leafy vegetable, pulses and fortified foods, and you must emphasize on vitamin C can improve iron absorption. So don't go away with an idea कि I am vegetarian, that's why I am anemic. That's not correct statement. This slide is very important. क्या खाएं और क्या नहीं खाएं, ये सब गवर्नमेंट ऑफ इंडिया ने बना के दिए हैं स्लाइड्स. यू कैन सी हियर द फर्स्ट टॉप लेफ्ट. अगर आप एनीमिक हैं, आप कितनी भी बढ़िया डाइट खा लेंगे, जब तक आप आयरन फोलिक एसिड नहीं लेंगे आपकी एनीमिया नहीं ठीक होगी. इफ़ योर हीमोग्लोबिन इज 9, इट विल रिमेन एट 9. खाली डाइट से नीचे नहीं जाएगा पर ऊपर बढ़ेगा भी नहीं, आपको आयरन लेना पड़ेगा. And it emphasizes that you must take vitamin C along with your food. That's very very important. हिंदुस्तान के अंदर जो भी खाना चाहें, if you want to use vegetarian food, there is plenty. If you want to take a non-vegetarian food, there is plenty. खाने की कमी आज के टाइम 2025 में कोई खाने की कमी हिंदुस्तान में नहीं है. 85 crores, 60% of the population gets free अनाज. उसके साथ और भी फोर्टिफिकेशन मिलती है. ठीक है. एंड कमिंग ऑन द राइट साइड, प्लीज माई रिक्वेस्ट अगेन टू यू, टी एंड कॉफी आफ्टर द मील शुड नॉट बी टेकन, एंड कैल्शियम एंड आयरन ऑल्सो शुड नॉट बी टेकन टुगेदर. Spend little time with her, just 5 minutes, and I'm sure she will be able to teach you next time when she comes. High impact strategies to break the intergenerational anemia in Bharat. Thank God the government of India had realized it, and this was started in 2018. 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. And I think all of you know about it. Intervention with iron, folic acid, deworming, fortified foods, and I think there the government lacks something. आपकी need का 20% it can supply. Fortification की अभी 80% और ज़रूरत है. बिहेवियर चेंज भी बहुत ज़रूरी है. बहुत मदर इन लॉ अभी भी कहती हैं कि तुम ये काली गोली लोगी तो काला बच्चा आएगा. तो दैट काइंड ऑफ थिंग्स हैव टू गेट चेंज फ्रॉम टाइम एंड अगेन. एंड डिजिटल मॉनिटरिंग इज़ वेरी वेरी इंपॉर्टेंट. नोबडी शुड गेट अप फ्रॉम योर क्लिनिक विदाउट गेटिंग योर हीमोग्लोबिन लेवल डन, बिकॉज जो आप देखते हैं कई बार आपका फॉल्स परसेप्शन है आपकी आंखों में. गवर्नमेंट ऑफ इंडिया सेज 1 nation 1 protocol. Uniform anemia screening, treatment protocol in every hospital, clinic, school, Anganwadi should be the same. And that's why the government of India has made PPTs, and they want it should be sent across all doctors, all nurses, so everybody speaks the same language. Catch them young. Know your hemoglobin, make them obsessed about hemoglobin of 12 and 12 plus as far as the girls are concerned. But if you find that the hemoglobin is 12 there in the man or a boy, you must spend little time with that particular lady and say that you must see to it that your hemoglobin of 12 gram is not accepted in a man and a boy. Screen every school. This you all know about it. It has to be frequently done. I think it should be done. She must be made obsessed about hemoglobin by the age of 10 years, and she should be told it should be done repeatedly. A personal record which is read hemoglobin card, very shortly the government is going to give it to you, where she sensitized that hemoglobin should be 12 and 12 gram %. You should eat smart. You can find that all these kind of things are very simple. It will take a minute for you to explain to her, एंड देन शी नोज दैट मैडम ये तो सब हम लेते हैं, बट मैं राजमा की बात कहती हूँ, बहुत लोग कहते हैं बहुत अच्छा है, मीट के बराबर है, बट ये रोज़ नहीं खाना, हफ्ते में एक बार खाइएगा, ज़्यादा खाएंगे तो परेशानी हो जाएगी. As far as the nutritional revolution is concerned, I think we must take the example of China. This is the need of the hour. One day when the black and white TV had just come, Mr. Mao had come on the television and said, no more Chinese cuisine, and you must see to it that I don't want China ko ठिगनी रेस से जाना जाए. I want people who are 6 feet tall is my aim, and that you will get it from home food, no junk food, fortified foods, dietary counseling to every family, and a best anemia dish competition should be there in the society, in the villages, in the welfare associations, and I'm sure people will come to know what is iron rich diet. This is, I was talking about food fortification. This is the sign you must remember whenever any product is fortified. This plus F will be there, and this is wheat can be fortified, so same is the rice, and you can add iron, folic acid and B12 here. Salt can be double fortified, beside iodine you can have fortification with iron, and fortified wheat flour mandated in ICDS program and midday meals as for the government of India is concerned, but I think it has to go to the public as well. Deworming twice a year has a magical effect. बस खाली यही simple intervention करो तो 30% anemia का incidence कम हो जाएगा. You don't give iron and folic acid supplementation. Just deworm your people and you find that the incidence of anemia will come down by 30%. It is mandatory covering, and in our once Dr. Gorak had told us, in my clinic now we started giving to 4 tablets of deworming tablets free. भैया आप अपनी फैमिली को दो, अपने बच्चों को भी खिलाओ, अपने हस्बैंड को भी खिलाओ जाकर. So you should see to it that you have dewormed them. What is the cost of treating anemia per adolescent girls? It works out to be 100 rupees per girl per year, and this is with iron, folic acid supplementation and deworming is highly cost effective, and along with that you have to tell them about the medical nutrition therapy is also critical. What Mission Gulabo is that you must get obsessed with severe anemia as well as moderate anemia, and you have to see to it that all these girls come out from moderate to severe anemia. Government of India, as for the pregnancy is concerned, they have a very clear guideline, very forceful guideline to say that any hemoglobin 7 or less need to be hospitalized and should be given a Paxil blood transfusion, and there subsequently whatever treatment you want to give it to it. And moderate anemia is IV iron, and there should not be any delay. Family should be also involve the father and the mother, and I think it works very well. Whenever you find your nurse or anybody is anemic, you must call the husband or you call the mother and tell them that they have to take care about it, and they will definitely see to it that the anemia gets cleared very fast. Postnatal continuity of anemia monitoring, Dr. Deepti just now highlighted that at the time of discharge from the hospital at delivery, she should have a hemoglobin, and she should be told thereafter she should get it done 6 monthly done. And this iron folic acid tablet she has to take it once daily for 6 months. And here I just wish to tell you that many of you forget about the calcium. It is 500 milligram twice a day for 6 months she has to take for her bone health as well. Now it has to be data driven monitoring at the district level, and you find that the programs where it has really zoomed very well are monitoring it very rigorously. It has to be turned into a social movement, turn Anemia Mukt Bharat and anemia awareness as a Jan Andolan, and just like polio eradication and Swachh Bharat Abhiyan. If we reduce anemia by 5% every year, Anemia Mukt Bharat will be possibility by 2047, and na kamzor maa na kamzor bachcha, anemia मुक्त है तो अच्छा ही अच्छा. जो आज लड़की का हीमोग्लोबिन सुधारो, कल की पीढ़ी बचाओ. So the pledge is I will stay anemia free myself, and I will help 5 my friends to do the same. This kind of awareness is important. And I will say again, this India does not lack food Only thing you have to tell what has to be taken. So thank you very much.